I'm
Mm,
looking forward to how people continue to figure out a creative way to still do the work
mm,
with the roadblocks that might come up. So I'm looking forward to seeing that. That's when people
mm.
come up with their best creativity, believe it or not, when given a roadblock. And you're like, but this is what we should be doing. People think of some of the most out of the box
Mm.
things that
Yeah.
are amazing. And so I'm looking forward to it.
Welcome to the Integrated Care Podcast from the Collaborative Healthcare Association. I am so excited to have our whole team here as we spend a little bit of time in end of the year reflection. I always like to use these kind of end of the year podcasts to be a little bit of reflection time. This time of year always gets me a little sentimental, has me thinking in my feels. And you're all gonna I'm just gonna drag you along with me for that. So we are going to start the way we always do with our icebreaker question. And I would love, as we're introducing ourselves, for you to just describe the last year for you in 2 words. Pick 2 words to describe your last year. So going around the circle here from my point of view, first we have Jen Thomas.
Oh, and I have to go first. Oh, you picked me, teacher. That's all right. I'll be fine. Jen Thomas, Family Med Addiction Med, Morris Hospital, co-medical director, CFHA, still leaning into that title. So that's probably one of my words, growth, like just new roles, new identities professionally, which has been really cool. And probably also nerves. I'm thinking back to the national conference when I had to like talk in front of that big group of people, and Neftali was probably like, enough, because I was like, should I bring my computer? Will it block my face? Would that be weird? He's probably like, get it together, man. Like just go. So definitely a growing edge, some nerves, feeling it out, and just trying to be in the spirit of like, hey, new things are good, and taking chances. It usually works out okay. So that's me.
For the record, that's not what I said.
All right. You were awesome. You
Just
were
in
just like
case. In
totally
case, yeah.
calming. You're like, you even said something really like profound. You're like, I think I feel like, thanks for believing I can do this. And you're like, I know you can do this. I don't believe it. I know. And I was like, dang, if CFHA like Jedi Master thinks I can do this, then sky's the limit. And then hopefully I didn't go fall on my face. So it's all good.
Next, we have Bridget Beachy.
My name is Bridget. Out here in Washington State, doing lots of BHCing and leading a group of BHCs and doing all kinds of fun things. We got our lab CFHA PCBH cohort number 3 lab starting in February, which is super exciting. The first 2 went really great. 2 words, yeah. I was like, yeah, I'm a little bit thrown off. I was trying to think of a word, something related to like experimental, like as in we're not quite sure what is going to happen, but we're trying a lot of different things. We're trying to stay open to different things. And so maybe like experimenting and maybe a little trial and error. So that those might all kind of go together. And then I know it's cliche, but I think within that is that growth and learning piece. So it's just like anything, right? The more you learn about something, the more you don't know. And you think that you know it until you learn more. And then you realize, oh my gosh, there's so much more I don't know. So I feel like I'm in that stage in my career where it's really hitting me how much I don't know, even though I feel like I do know a lot. It was easier sometimes as an early on BHC because you just thought you knew everything.
Right. I feel like
Mhm.
there's a whole mid-career
Yeah.
conversation that could grow out of this in terms of I already knew I didn't know everything. And then I learned some stuff and I knew how much more I didn't know. And now people expect me to know things because I've been around for a while. So we'll table that. I have a whole list of guys, I have more ideas right now for this podcast that I'm excited about that are gonna come up in the next year, but I'm gonna add that one to it. So thank you, Bridget. Next, we have Monica Harrison.
Hello, everyone. Monica Harrison, licensed clinical social worker, integrated care lover of all things integrated care, a clinical trainer and practice coach at the AIM Center. When you asked the question, 2 words for the year, I thought the word that probably I shouldn't say on this platform that starts with fire trucks. same letters fire truck starts with. The fire truck would probably be my 2 words in general because I have just had a year. However, the 2 words I will give are pivot and growth. That's all I got. Pivot
Yep.
and growth.
It comes out of that fire trucking
It
situation,
comes out of the
doesn't
fire
it?
truck. Like, what the fire truck? So yeah.
Thank you, Monica.
There's Monica
Uh,
trying to keep it PG.
I don't know how it would affect things
Trying
if we
to end,
flip
trying
it
to
right in
end
for
the
our podcast.
year, trying to end the year doing the right thing.
Well, so you're trying to pivot into a positivity for the new year. I get it. I
Yes.
get it.
Pivot.
And then now you're hearing Neftali Serrano.
Hi, everybody. And it's always great to be with you all here on the podcast and you all, our listeners. All right, 2 words. Oh, so I'm the CEO here at the Collaborative Family Healthcare Association. 2 words. So I think similar to what's been said, I'll just use the word stretch. It's been a very stretching year. Our team went through a very arduous software transition that reorganized all of our lives all year long. We made it successfully here to the end, which is good, but it took a lot out of our team. I compared it to like an EHR transition. That's pretty much what it felt like. And I think on the other side of things, I think confidence. I think having gone through a lot of things professionally and building that resume does help Jen with the imposter syndrome, with the just self-doubt. So I think I definitely grew in confidence this year in terms of leadership skills and just also just feeling more comfortable in my own skin. And that's not just professionally, but personally. This has been a big year. You guys have heard me talk about in the podcast before about the empty nesting period starting for us, which is funny because all the birds have returned to the home now. They're back in home from college. And I hope they're not listening. They don't listen to this thing, but like now I kind of want them out because house is way too full feeling right now. But no, so it's been a stretching year in a lot of ways, but then just feeling more confident in the sense of like, you know, navigating these transitions in life does when you get through them and you're still in one piece. Like Monica will be in one piece. 2025, she'll make it through. You just build confidence from there. So that's nice to feel.
Shows you what you're made of.
That's right. Yeah. What's it? If it is Kelly Clarkson's song, if it doesn't kill you, makes you stronger, something like that.
Yep.
Yeah,
Yep.
that's it.
Well, thank you all. I am Grace Pratt. I am the behavioral medicine faculty at Integra's Great Plains Family Medicine Residency Program in Oklahoma City, Oklahoma. And I would say 2 words to describe my year. One has been connection. I think back to even just the last time we were together in person in San Antonio and all of the wonderful connections I was able to make just sitting down. And I think there's been a really lovely this year leaning into authenticity and connections and like, yeah, here's who I am, here's what's going on, and we're going to connect around that, good, bad, and otherwise. And then my other word is creativity. I've been doing an expressive arts therapies course for some of my CEUs for this year, as I've been trying to find other ways to help lean into trauma-informed care and working through dysregulation. And a lot of the work that I've done over the last several years, I've talked about on the podcast, is around biofeedback and dysregulation and understanding chronic stress and trauma. And I'm always trying to help build tools in my arsenal for helping people to experience and move through that dysregulation, whether that's the learners that I work with or the patients that I serve. And that's been a really fun just experience. You don't have to be a skilled artist to do expressive arts work. You just have to have an appreciation to move through those places in your body and those places and creativity and different materials. And it's been really fun. So creativity and connection, that's been my 2024. Neftali, are there news and notes for today that we need to share?
Yeah, just a quick news and notes as we get into the new year. I know a lot of folks are winding it down for the new year, but some folks are also thinking about their professional lives and careers coming up for 2025, how they're going to invest in themselves. And certainly like to encourage our listeners, if you are healthcare professional, whether you're in the medical side of things or the behavioral health part of the care team, check out our training events for 2025. We have slowly been building up sort of a repertoire of not just courses, but people. And that's really important to us here at CFHA. People who are just quality people who do great training, who are great mentors. And so if you go to our website, cfha.net, and you can go under the events tab to look at our calendar. You'll see all of our calendar items, but you can more easily go under our training resources link there. And you'll find something for care managers. You'll find some stuff for medical professionals in terms of leadership development. You'll find Bridget and David's course there for PCBH implementation. There's really something for nearly every member of the care team. So check it out, invest in your career. We invite you to kind of join us on that journey. And we've got some exciting new events planned that we haven't done before. Jen is actually going to help lead with her co-national medical director a course that they've named MCHIC, which is a great name. Is it MCHIC or it's MCHIC? Sorry.
We're going
We
with
decided,
chic. Chick
yeah,
was a
chick
little
was,
too.
yeah, that you could get me in trouble there.
It's all good. It's all good. It's chic.
Yeah, it's MCHIC. But basically, it's a course directed at medical professionals, particularly, well, not a course, sorry. It's a group, it's a cohort,
Yeah.
right?
Yeah.
Of folks
Yep.
coming together on the medical side of things. So if you go into the events tab, you'll find that. That's totally free to join. And it's just going to be a place for medical professional champions in integrated care to gather, support one another, help each other with program development ideas, professional development ideas, leadership ideas, figuring out how to advocate, bill, all that stuff that is just part and parcel of making things work. So between our events and our training opportunities, you have opportunities here at CFHA to invest in your career in 2025. So check it out, just cfha.net under the menu.
Awesome. Thank you so much. So, I want to transition us into our main show conversation. And like I said earlier, I always feel a little reflective at this time of year. I actually felt lucky because with the residency calendar starting in July 1st, and then the school, like the calendar starting in January 1st, there's twice a year that I'm like, "Ah, I just want to look back and look forward and think about all the things." So here we are, and I'm making you do it with me. But I have shared a list of questions with my co-hosts here that are from an author named Tish Oxenreider. She's an author, speaker, and she has these 20 questions for reflection in the new year. And so rather than me posing all the questions, I have shared them with my co-hosts in our Zoom chat, and I'm going to give each of them a chance to pick a question to throw out for all of us to reflect on as we're looking back to our last year, and even maybe getting into a little bit of looking forward to the next year and this time of, just reflection and transition. So maybe we'll just spin the other way around the circle. And Neftali, you want to throw out a question for us to reflect on?
Yeah, so happy to do so. This is a great set of questions. I wish those of you who are just listening can't see them. They're in our chat. So we've got like 20 questions to pick from, and the one that stood out for me, and it says a lot about kind of my own sort of perspective on life. I'm not trying to be negative here by picking this one, but this is the one that stood out to me as the thing I'd be most interested to know about you all. And that's because I've realized that efficiency is a value in my life. Like it's just I never thought that. I'm Latino. We're not supposed to be terribly efficient, but it is like really important to me. It drives me crazy when things don't work right. So the question that stood out to me was, what was the single biggest time waster? What was something that felt like it just wasted your time this past year? And I figured I learned something about you all through
You
that.
want to hear how inefficient we are? Is that what you're trying to figure
I
out?
want to fix it. I want to fix it. Yeah. So
Ah.
yeah, biggest time waster.
Uh, Well, I'm a primary care PCP. Let me count the
Oh
ways to
gosh,
talk about
yeah.
inefficiency. We can talk for days on all the crap we do that we shouldn't.
Oh
I don't
gosh.
know. What sticks out is the busy work and charting in primary care. You know, the EHR should be intuitive. We should have team members working to their skill set, and yet it's I put on my own referrals and all the BS that goes with the inefficiencies and just the, I think, acceptance that providers sort of just like, well, I could get on a committee and have 10 meetings and then get shot down 5 months from now that no, we're not going to do that workflow. So screw it or fire truck it. I'm just going to put in my own referral. Because you just kind of, and I know that's probably like the bad answer because then you're like enabling like inefficiency too. So I don't know. I'm not that pessimistic. In some ways, I'm like we can change this. Let's do this. And then other days it's like fire truck. So.
Fire truck it. Yeah.
Yeah. I mean, I would say these reels and the scrolling, it's like the new, back in the day you would sit in front of the TV and kind of mindlessly watch
Channel surf.
TV.
Yeah.
And now, yeah, channel surfing. And now it's like the doom scrolling that happens. Now, I think that if you have it within like a reasonable time, like, okay, for 15 minutes, I'm going to do this and I'm going to send funny reels to my friends. I think that's fine. It's like there's nothing that's good or bad, right? And it's a really good way to connect with your friends. We're always sending each other reels, but there's sometimes where you're in that doom scroll and you're just like completely mindless and completely numb. And that is like the biggest waste of time. And then also trying to solve problems that you have no control over. I have a tendency to do that. I'll like ruminate about like this thing
Mm-hmm.
that is in a different department that I have no control over, no influence of. I don't even know all the factors of it. And I'm like brainstorming all these ideas. And
Mm-hmm.
it's like, Bridge, like, that's not the probably best use of my internal or external time. So those two get me, and I want to do better on both of them.
I continue to waste a lot of time trying to onboard my students because I interview them in like February and accept them in like March, and they're supposed to start in May. And somehow all of the bureaucracy of agreements and EMR training and getting this form in, and then this person has to chase down that vaccination, and then the person who's the student coordinator is on vacation, and then we got to get them in, but like, I need to start doing their training, and it got pushed back this year. And so then I was trying to have residents on rotation with me and train a new BHC, like brand new at the same time. And it was not a good situation. So I got to figure out that onboarding process. And I don't know how. It's real broken in my system, but that wasted a lot of my time this year. And TikTok, but like it's
But that's fun waste. That's fun waste. My real answer is Netflix. I waste time watching Netflix. First thing in the morning, I get my coffee. Matt's like, you could exercise. And I'm like, I could just curl up in my PJs and see what's happening and, Gilmore Girls for the 20th time or, whatever.
Well, supposedly, Jen, I do not actually know this from personal experience because I have not used this feature, but apparently my Peloton has Netflix on it now as an app. So you can ride and watch at the same time.
It's right there. It's just waiting for you to exercise while
again,
so
I've not done it. My 9-year-old keeps issuing me this challenge of like that I should ride my Peloton and this is the reward that he's going to give me. And I have not accomplished the challenge. Although supposedly this Sunday, if I ride for 30 minutes, he's got a big reward for me. So we'll see.
All right.
You
can do it.
Trying to do some behavior modification with you and give you some rewards up in there.
I'm like a true oldest child. He's like,
so cute.
Do this. Here's the reward. Here's the system.
You better jump on that.
I know. Well, I got to see what the prize is now. It's a mystery surprise. It's a mystery prize. So now I'm more engaged.
Hopefully it's something good, not like a homemade craft. No offense. I made you this thing and it's pottery. Got a million of those.
Decide,
they're great.
Is it an ashtray? Is it a ring holder?
Is it an elephant? What? Yeah. But it's made with love.
There you have it. Well, I was going to come in with a real Pollyanna view. No shade to my aunt whose name is Polly. She hates when I say Pollyanna. I was going to come in with a real Pollyanna view of like, is anything a time waster? Like, if it gives you an opportunity to numb out, to reset, because that's what you need in the moment, Or you're having a 51st dates meeting with a group and you're repeating the same thing, but it gets them one step further. And then I remembered that I have actually been in some staff meetings that could have been an email. And I'm trying to figure out what's the Pollyanna view to that.
Mm.
We were all on the Zoom together and that builds relationship.
Mm-hmm. Mm-hmm. Good.
So
Good
is
job,
anything
Monica.
really a time waster? That's where I was going to go. So I'm glad I just figured that out. Is anything really a time waster? It serves some purpose.
Well,
Does.
you're
Might not
talking
be
to the
But
wrong,
efficient,
you're
but
talking to the
marketing
wrong
has a
person here.
function, right?
look at that's give it Neftali. Like, is everything really a time? Might not be
I
efficient.
suppose it's relative, right? It's relative to what the time could have been used for, right?
Well,
Yeah.
okay, so
This,
then turn your own question on you,
yeah,
Neftali.
like tell
How'd
us
you
what's
waste
your
your
time
time
Oh
waster?
gosh.
there?
He's
Oh,
like,
there's too
let me
many to
pick
count.
one.
Too many to count. Yeah. No, I mean, you know, I almost too obsessively. I probably need to work on it, but you know, try to maximize the time that I have in my day. And I create a lot of suffering for myself as a result because I probably try too hard to do that. But for me, yeah, it's just processes that slow things down. It's when people want to talk about something instead of do it. You know, you know, yeah, I try to get those things as much, you know, out of my life as possible. However, I will say, you know, talking about what you said, Bridget, and your perspective, Monica, you know, like I have learned how to intentionally waste time. In fact, my wife has this book. I haven't read it, but I see the title every time. It reminds me like I need to work on this. It's like the art of wasting time, or the art of like doing nothing, you know, kind of a thing. Just to sort of not be 1,000% purposeful every second of the day, right? There's a place at which mindfulness can be like a bad thing. You know, it's like you're way too mindful. Just waste some time. Just do nothing. That kind of a thing. So I'm actually working on that side of things. I was hoping you guys would help me with ideas to waste my time. So on that vein though, I bought myself. So one of the practices I've had in the last few years is I have started giving myself Christmas presents. And this is part of the empty nesting thing because you know your kids they're not going to give you Christmas. They don't have money to give you Christmas presents, and you know dads are incredibly hard to buy for. And so I was like, you know what, I can buy myself a Christmas present. And this year I decided to get something that was completely purposeless. Like it's just not something I need. It's not something that is going to lead to anything, but it just sort of incorporates sort of the way I think I could spend some time and do nothing. So I bought myself a 3D printer. I have nothing to
Oh,
3D print. There's nothing I need to print. There's no need for it in my life. But I thought, you know what? I'm always interested in that kind of stuff. I'd love to figure it out for absolutely no reason. And that's what I did.
Did you make anything? What did
I'm
you print? Did
saying
you?
I
Oh no,
like
I haven't.
this
It's
though.
it's it's
Oh, the
Somebody's
uh
gonna
box.
need you to make
it's in
something.
the box. Yeah, in fact, my
Yeah.
kids are making fun of me because they saw the box
You bought
and
it
they're
and didn't
like,
use it.
Did you buy that for yourself? I was like, yeah, it's my Christmas present to myself. And I was like, as I saw, I still need to wrap it. And like,
Mm-hmm.
you're gonna wrap it? Like,
Mm-hmm.
you're gonna wrap it for yourself? You already know what's in
Like,
there.
yeah,
Right.
I want something to
I was like,
unwrap
I
too.
want to unwrap it, and I want other people to be surprised too, because not everybody knows what's in there.
They'll understand
Mm.
one day. That was a
Mm-hmm.
great question to start us off, Natalie. Thank you. So again,
Mm-hmm.
back around
Mm-hmm.
our circle, Monica, what question do you want us to chat about?
Well, I mean, that this is not one of the questions on the list, but like listening to Neftali, I'm like, oh, should it be what have we wasted money on this year? Like what? Like it should it be? Is that the question? What do we waste money on this
Oh,
year?
getting real.
Okay, right, because that can some problems happening. Okay, I am going to go with there was a question around joy. Okay, wait, let me find it, y'all, so I can read it to you the way it's written. Why can't I find it? Okay. What was an unexpected joy this past year? So unexpected. Let's see. Grace, you go first. Since you're always making us go first. You go first.
An unexpected joy, I would say, came from getting to know one of my coworkers more. So I'm not surprised that I like her, but we have
Yeah,
a newer
I'm
faculty.
glad you put that caveat there because
No,
you're going
yeah,
down that
Everybody,
road, and I was like, ooh,
not
everybody at
exactly.
her
look at these.
job is gonna be like, well, wait, was it
Yeah,
me?
right. Yeah, it's a bit.
Was it
No,
me?
what? So we have a newer faculty member, and it's funny because I've been around long enough that she rotated through as a resident, and she interviewed with our program, and she was almost at the top, if not or close to the top, if not at the very top of our rank list, and she rejected us and went somewhere else. But then we got her back as a faculty member, and she's been here for about a year and a half. And over this last year, we've really got to spend more time together inside and outside of work. And it's just been so fun getting to know her and her family. And I think one of the reasons why it's unexpected is because her faculty at our program has been very stable for a very long time, which is wonderful. Except at 10 years before she started, well, I guess I was 9 years when she started. I was the most junior faculty, and everybody else is a 60-year-old man, pretty much. And so to get to have a colleague who's a young woman who I can spend time with, and like I tend to plan my precepting time around when she's precepting so we can hang out together and join together. And so that has been a very joyful but unexpected treat for her to come back into our program and into my life in this way and get to be friends.
Yeah, friends at work's important. That's great. Glad you have that. That's great.
Yeah, it's a small example of how representation matters too, right? Across
Mhm.
a variety,
Yeah.
right? Because an environment doesn't necessarily have to be intentionally hostile, right? It's just like it's just not doesn't feel comfortable. So yeah, makes a big difference.
And I have wonderful colleagues that I work with, but we just relate in a different way.
Sure.
Yeah. Gotcha. Bridget.
There's a lot, I feel like, that running through my brain. One of them is just we have unprecedented levels of BHCs at our clinic, to where we have a higher than 2-to-1 ratio at our main clinic many, many days. So like we might have 7 BHCs with 11 medical providers on in clinic. And it is it's a really interesting experience back in the day being like just Dave and I with like one or two other colleagues, depending on the day, because it's not like everybody, there's 4 of us in the mix. It's not like all 4 are working on the same day. And so there just could be 1, 2, 3. I remember doing so many solo clinics. And now like having 5 BHCs wasn't enough. So then we went to 6. And then starting in September, we now have 7 like multiple days that I'm in clinic, and it's a real joy. And it's so weird walking around at CWFM and running into BHCs everywhere you go. You go into a medical pod, you see more BHCs than you do PCPs, depending on the day. And like even down in our little office space, there used to be nobody down here. Now at like lunchtime, there are like swarms of BHCs. And it just brings me so much joy. And we're shadowing, like even if there's 7 BHCs who are seeing patients, there could be 2 other BHCs that are shadowing the medical providers. And then one of them's down on like admin time or doing supervision. So like I'm just not used to working alongside so many BHCs, and it is so joyful.
Bridget,
Mm.
it feels like in some ways, if you guys keep moving in this direction, you're going to work yourself into a reverse co-location situation, just like by accident. You're
I,
taking over. This is our space now.
Full
you know
circle.
it, our overhead is so small as a
Yeah.
BHC, like I know that other places struggle financially with integration, but in FQHC, it's a very fertile environment for in Washington State. So those combination and our overhead is so low that like you barely need an MA, you barely need a nurse, you barely need for like each BHC you add, you barely need these other things, other positions and equipment and like actual physical things. So
Love
Mhm.
it. Mm.
and it was unexpected. I didn't think this was, I never even pictured that this could happen.
Yeah.
Mhm.
Yeah. That's a good unexpected joy.
Mhm.
I like that.
Mhm.
Neftali, where you at?
So I think The thing that came to my mind professionally was I started executive coaching this year, and I think that has become an unexpected joy and has elicited a lot of really, really positive outcomes for me personally. I've learned a lot about myself, about my leadership style, about my approach, about ways that I could um, use what I'm good at, but also learn other ways of leading and things like that. And it's not that I like thought it's like what you said before, Bridget, about like you don't know what you don't know, basically, professionally. And I realized like, wow, I've been leading for a long time, but having someone else there to help me think through how I think about things and how I lead other people is fantastic and freeing. So it's been great to, yeah, just great to get that feedback. And that led to another unexpected joy. And it's not at all that I never had faith or confidence in our staff here at CFHA, but one of the byproducts of the work with the coach was really for me to learn how to better enable and empower others around me and expect more of them, but also enable that expectation in them. And so we really raised up 3 director level individuals on staff this year, 4 including the medical directors, and they just hit it out of the park. I mean, like we had our board meeting in October. Monica was there,
Hmm.
and just seeing them present, I didn't I
Like
didn't even
natural
vet
leaders.
I didn't vet their presentations. I said, this is your area. This is what you're going to present to the board. You're going to be accountable to the board. You're going to represent the work that you've done, and they just blew it away. I mean, it was fantastic. So just seeing people flourish like that just was another unexpected joy. So really, really cool.
Yeah, I think that's one of your
Allowing them.
gifts, Neftali, as a
Yeah.
leader, is inspiring others to lead. Like, you can do this, take a step. Here's something you can do and be competent at and excel at. And it's a really cool, you know, drop in the water and the ripple effect that that has with believing in other people. And I think that's kind of the epitome of leadership, right? You're teaching and inspiring other people to lead alongside you. That's fantastic.
And allowing them to shine, because I think that that's the right. Like you don't need to
Yeah,
dim their light to just make you
yeah,
see, like that, allowing them to shine. And some will want to and some won't, but giving them the opportunity for growth,
right.
like that's a big deal. I think
Yeah,
that's a big deal.
yeah, and just to be just slightly more tangible about what the coach helped me with. So one of the things that he helped me to see is that my leadership style naturally is sort of a pace setting leadership style. So I'm the person that runs out in front and shows people how to do it, right? And that's fine for a time, but if I'm always out in front showing people how to do it, then no one has an opportunity to take the lead and take ownership and take it themselves and become pace setters themselves, right? Once that kind of clicks for me, and it took months to kind of work through this and probably the last couple of years at least, then I've learned how to just give other people space and just be like, hey, this is your space, do it. Like this is what you this is your area. And you come back to me when you need some coaching, but otherwise this is what you own. So that's been transformative. Yeah.
Yeah. I heard
That's good.
Bridget just dropped in the chat about leadership coaching. I don't think we all think about it that often, like the importance of those of us, whether you've been doing it forever or you just started, but what does that look like to sow some seeds in your own basket so that you can grow in that area too? I
Highly
like it.
recommend it.
Yeah. Jen, where you at with your joy?
So many good things come to mind. I guess mine's similar related to Neftali's. I didn't do a leadership coach, but I did leadership course. Andy Valeris has a physician leadership course that I did. We started in January and finished up like in June. That was an awesome experience because I don't know, as a clinical physician, it's like we never were taught any of that. It's like microbiology and CFHA protocol. Like there is no curriculum on being a leader of a group or communicating in ways that restore relationships. There's just a lot of like hierarchy and like, well, I said do this because I'm the boss, I'm the doctor. And it's like that doesn't work. Or if it does, people burn out on that. So it was an amazing opportunity. And just this whole like I had no clue this even existed, this whole field of like leadership skills and communication styles. It was just like mind blowing. It was, I think, a cohort of like maybe 8 of us and a few physicians, a few nurse practitioners. A lot of them were like clinical, like peds or IM, that were now in like CMO roles at a FQ or similar things. And so they were all kind of like me, kind of navigating the, okay, I identify as a clinician that sees patients all day, and now dipping the toe into, now I'm leading something, and the imposter syndrome that goes around that, and the feeling ill-equipped, but wanting to learn more of like, all right, that didn't go great with, those 2 employees that had that conflict. What skills can I get to apply to help us be a better team? Like that was a really awesome experience. So yeah, I think my joy has kind of been these, and just hanging out with more CFHA people. I joke with my medical providers of like, I'm saying things like contextual interview, and they're like, what? And I'm like, every behavior makes sense in a certain context. And I'll be damned if that doesn't. That's true. Bridget's right. And so when we're, at lunch, like, why did that kid have that, wouldn't go to school? Or why did that, teenager, whatever, get busted for the drugs? It's like, there's context there. And like, I don't know, like just your guys' influence. That's where I'm really excited about MSHEIC and all the medical folks. Like there's such an appetite out there for medical people to have some additional language and knowledge. And not that they all have to be many therapists or many psychologists or many psychiatrists, but just some basic framework of like, this can help me be a really better provider to connect with patients and really make a difference. So I think it's all that. It's just this soup and milieu of you guys and all your wonderful vibes of, the behavioral health stuff and the medical people. Hell yeah, we got lots to learn. So come on down to CFHA. The sky's the limit.
Get together. Come on.
Yeah.
2025. I would say for me, Joy, the latest one, and it was unexpected because I have become so accustomed now to doing trainings and meetings and all of that via Zoom. And I've had the pleasure over the last couple of months to do a lot more in person and just with BHCs. And don't get me wrong, I love the team. I love my physicians. I love my community health worker, all of the folks that make up the team. But I really just enjoy being invigorated by a room full of clinicians trying to do the work and figure it out and asking the questions and the collaboration with each other. Um, and the commitments that were made amongst each other as a group of new clinicians, that really brought me a lots and lots of joy that was unexpected. It was really unexpected. And so that was my unexpected joy from a professional standpoint.
That personal connection goes so far, and I think we've gotten good at Zoom, right? We've gotten good at what we can do and how we can reach across and how to maximize, all of the benefits of it. But man, if it isn't good to be with people in person. Bridget, what question do you have for us to chat about?
So I was going to do, because I had picked it prior to anybody picking theirs, but I'm going to change mine. I was going to do what was the best way you used your time this past year, but I'm going to pivot to, because we already talked a lot about time, to what was the biggest thing you learned this past year? And that's kind of makes it really big. What is something really important that you learned this past year? So it doesn't have to be the biggest, but what's something important you learned this past year?
So I learned, maybe it was reinforced. I don't love being told no, or like offering something and someone being told no. Not that I get like, but I'm like, oh, okay, never mind. I guess it wasn't important. And it wasn't that I had been told no, but I've been offering to my kids' school to do a training on resilience and well-being for the staff for a long time. And like all this stuff I'm saying to our medical providers about burnout and about, not having enough time and needing to regulate in the moment. Like, oh my gosh, I'm at my parent teacher conferences, or I'm volunteering making copies at the school, and a teacher runs into pee because they literally have to ask permission to find someone to cover their class so they can go to the bathroom. Like they need it too. And I've been offering to do this training for a while and it hasn't come together. It hasn't come together. And so I kind of stopped offering for a while. But then we got a new principal and I was like, hey, I've offered, I could do this thing. And she was like, yes, let's put it on the calendar. And so I didn't give up when I was kind of like brushed off before. And I went and did it the Friday before Thanksgiving. And it was such a wonderful time. I just did an hour, but introducing dysregulation and mind body and all of the things again that physicians need and our clinicians need. And I have had almost a dozen school teachers and staff like reach out to me and say, thank you, this was so meaningful, thank you, we needed this. And just thinking about expanding on those connections that we're making with schools in our last episode. Like if you did not listen to that, go listen to it. And thinking about just the opportunity to give, like I kind of had relegated myself to being like, maybe this isn't as important as I think that or is it as needed as I think that it is? No, it was. It just, things are busy. So I kept going, even though I was saying, not hearing a big positive yes. And that was a good lesson for me to learn.
That's awesome.
Great.
Mm-hmm.
Don't ever accept that premise, man.
Mm-hmm.
Don't accept it. You said it.
So one thing I would say I learned this year, this is related to integrated care, is I've been doing a lot of thinking over the last couple of years together with our measurement-based care work group about measurement and why it's not done very often in primary care settings for behavioral health measurement, outcomes measurement. And one of the things that sort of it dawned onto me is that a couple things. One is we don't have the culture of medicine. The culture of medicine is centered around measurement to a large degree. Labs, vitals, most differentials are going to involve some sort of measurement of some sort. But then I realized, oh my goodness, when was I ever trained how to measure? And I literally could not think of one experience other than psychological testing, which is not the same thing as outcomes measurement. I could not think of one professor, one mentor, one supervisor, even who ever talked to me about how to attempt to measure outcomes with a patient. Not once. I've been doing this for 20 some years, right? So once I figured that out, I was like, oh, okay, that helps me be a lot less judgy of myself and others. I'm like, okay, that's a big piece of the barrier here. We need to train people how to think about measurement, because the other thing is people don't really actually understand it. A lot of times people reject measurements because they don't understand. They don't understand what it actually means.
Mm-hmm.
And so I've had to go through processes here of like kind of teaching myself what that means. What does it look like to integrate into a typical PCBH visit? How to be flexible with it, when to use it, when to not use it, that kind of a thing. The same things my physician colleagues are doing all the time, right? Thinking about when to do labs, when to not do labs, what's the most strategic use? When do you trust the lab value and when do you don't? When do you go with what the patient says versus what the lab value says? All that same stuff. And so it's been a good journey. So yeah, that's something, it's been a light bulb moment for me.
Yeah, I think that measurement piece is a good translator piece for medical, that is kind of like weary of integration. It's like, okay, you have that framework for labs. You can do that type of work with behavioral health interventions and outcome screenings. And for some learners that might be kind of weird, like, okay, I kind of see what you're saying. I can sort of think about, measuring symptoms. And that's not the whole story. You can't do PHQ-9 as like your live and die on that score by any means. But yeah, I think putting it in that lens that people can relate to if you're early in implementation is really helpful. And I think on the provider side, where we get kind of cranky and negative, is the reflection back on productivity and provider experience and scores, that when that data is shared without context, I keep coming back to context, Bridget, today, but it can feel like very negative, like the dichotomy. It's pass fail, it's good bad, you performed or you didn't. And that messaging, I know, contributes to burnout, because if you just get this data dump from admin that's like, we're not meeting the mark, and there's no context with it, it does a lot to really disincentivize the workforce to try, because it's like, well, what are my modifiable risk factors? I can't help the parking lot, if that's what the survey applications are, nowhere to park. Okay, I can't control that. What can I control? Or if I come to admin with an idea of this is how I could be more efficient, having a context and let's engage on problem solving on ways to take that data, that measurement, and do something that feels productive with it rather than just pass fail. I don't know if that makes sense. It's just something I've
It
been chewing
does.
on.
No, yeah. And you bring up another level light bulb moment, which is that admins don't know how to use measurement either. Like
Right.
that's the completely wrong way to use measurement,
Yeah.
right?
How do
If
you, so
that's
what do you
what
do
you're
with that?
doing.
How do you teach? Do they need to
Yeah.
take a class? Like, seriously, like, what do you do to help your admin
Yeah,
know the
I think there
context piece?
is. Yeah, and that's something we're working on. Working on like some sort of a course for measurement and building clinical skills, like exactly like how do you build it into a visit and how do you use it? How do you think about it? What's basically what you're saying? How do you put the context
Mm-hmm.
around the number, right? Because the number is not the whole thing. It
Mm-hmm.
is a piece. It's the same thing when again, it's the same thing that physicians do all the time. Is the A1C the end all and be all? It's not. Like any primary care physician knows that. That's why if you get a report that says, oh, your A1Cs are percentage this is it, it's like that's not the right way to think about it, right?
Mm-hmm.
You have
Mm-hmm.
to be both statistically and you have to provide context for those. So you understand, oh, okay, I understand why you're making these decisions as a provider based on that. So
Yep.
yeah,
Pull
I
all
think
your
it has to be said.
information.
You're right.
Yeah.
Mhm.
This year, I have this shirt that says unapologetically Black.
Mm.
And I this year have just been unapologetically Monica, period, with the DT on the end, as the younger kids say. That has been freeing, probably has not felt the most efficient to some individuals that have had to work with me. But yeah, unapologetically Monica, professionally, personally, this is I'm gonna show up. I always have been a keep it real person, but I also keep some things to myself because some people ain't ready to hear some things. And so, some people just ain't ready. And now I'm like, well, you know what? If you ain't ready, that's on you, but here it is. So do what you want to do with it. So yeah, that's been my thing that I have gotten to know more, grown more into this year.
That's super awesome. I just want to say, Monica, I have noticed that and I've
Have
loved
you
it.
really?
I have. Absolutely. I have.
Well,
And
you've known me for a long time, so
I
that
have.
is actually
Yeah,
pleasing to me to hear that you have,
absolutely.
yeah.
Yep. I knew something had shifted and I didn't know what it was exactly, but I was like, I like this. Like this is, more of your whole self coming in and
Yeah.
just to inspire you and other people to like do that. Like you doing that, me seeing you do that. Monica's on the board, so that's one of the ways we interact and lots of other stuff. But like it also has helped me to do that for myself, right? It's just like I know culturally, I bring more and more of my Latino-ness now out into the spaces that I'm in because it's the same thing. It's like, you know, I I accept that a certain amount of code switching is always going to be necessary on some level, but like I don't have to I don't have to bend over backwards for for every single
Right.
group I meet with, right?
Right.
So yeah, so thank you.
It's free. No,
Yeah.
thank you.
Awesome.
Everybody be unapologetically yourselves. And people gonna take it or they'll leave it on the table. Okay.
You know what the funny part, a piece that solidified that for me this year, and this is not a fun thing, but like I literally thought to myself, I was like, if that guy can be president and he has absolutely no filter
I
whatsoever,
mean,
I'm gonna be me. I
what we
mean,
doing?
you can take me or leave me because if that guy,
Yes.
right,
What we
If he can
doing?
do
if
it,
he
Just
gets to
saying.
do it, if he
we can
gets
do
to
it
do it, I
too.
get to do it.
That's great.
I'll
I
take
Silver
it.
love it.
linings.
Silver linings.
Did everybody do their learn?
Um,
I think so,
I
yeah.
kind
Yeah,
of
yeah, yeah,
chimed in.
yeah.
Yeah. I don't know. Maybe I know. Should I wrap us up with what are you looking forward to the most next year? Is that a good
I
way to
love
end? Like
that.
2025. What's the thing? Like, what are you
There you go.
excited about? What's happening? What are you going to be doing, seeing? Who wants to go? Grace?
Yeah, I'm getting married. I know that's not
Woo!
professional. That's not about my
That's
work
great.
life.
Yay!
I'm really excited.
Your happiness
That's
contributes to your
awesome.
professional self.
Yes.
So,
It is.
yes.
It is.
Awesome.
And I think just along those lines of what, Neftali and Monica, what you were just saying, of just continuing to step into more of like who I am in all of the spaces and owning and taking up space of, what I do know and what I am an expert in and the voice that I have to contribute. That my tendency is to always to step back and listen. And I think that's still a valuable skill, but also sometimes it's time for me to speak up. So those pieces, and yeah, getting married. I'm really excited about our wedding. It's going to be a really beautiful garden family event. So yeah.
Awesome. I love it. I love it. All right, Bridget, what are you looking forward to in 2025?
So Dave and I and Deepu have some things in the hopper. For anybody who's seen my Access V filter and diagram, it's basically jumping off the contextual interview. And when you are listening for a person's ACEs, cultural considerations, their internal context of how they see themselves, the world, others, their external context, which is how they go through their day, stage of change, social determinants of health and values. So basically, when you're doing the CI, you're listening for all of those things. And you, as the clinician, need to filter whatever evidence-based interventions and knowledge through that before, you're gonna have to filter that through that with the patient in that process so that it's, relevant to them. But me, Dave, and Deepu have another thing in the hopper about the clinician stance and what is necessary with the humility and not trying to fix people and how you show up in that space to make it pop even more. So more to come on that.
I'm signing up. You had me at
Man,
contextual
that's
interview,
some good
Bridget.
stuff.
You
Some good
had me
stuff.
at the end showing up like you're showing up in their space. They don't need to
Yes.
come to your space trying to figure out
Yes,
how to fit in and show up.
Yeah.
100%.
Yeah.
Yes.
I love it. I love it. Monica,
So
2025, what's your bright spot?
2025, my house will be done, so I
Woo.
will be settled. I'm looking forward to that immensely, and more DEI work. I'm looking forward to more DEI work, even amidst the political climate and changes that that might bring. I'm
Mm,
looking forward to how people continue to figure out a creative way to still do the work
mm,
with the roadblocks that might come up. So I'm looking forward to seeing that. That's when people
mm.
come up with their best creativity, believe it or not, when given a roadblock. And you're like, but this is what we should be doing. People think of some of the most out of the box things that
Yeah.
are amazing. And so I'm looking forward to it.
So important. So important right
To
now.
some
Awesome.
really
Neftali, what's your 2025 looking forward to?
Yeah, I'll be quick here. So I think there's lots of fun stuff. One is AI and just leaning into using AI as a strategy for our organization, for our staff, for our members, and helping our members learn how to navigate and use it more effectively. And just seeing our staff continue to just grow, just like I talked about this year, just seeing what they come up with.
Awesome. I love it. I think I'm looking forward to the podcast. This is like the best part of my day. I don't know if or my month, whatever. So podcasting in 2025, I'm there for it. So, all right, Grace, land the
Aw,
plane.
well, yeah, you guys, this was so wonderful. Thank you for just chiming in with me, being willing to look back and reflect. I hope that for our listeners, and we can plug these questions in the show notes and some more as well. I hope this is a time of reflection for you, looking back with gratitude at this year and pride at the challenges you've overcome, and hope as we move into the next year. We hope you'll come along with us. We have a lot of exciting things planned for next year. So thank you to my co-hosts. Thank you to our listeners, and we'll talk to you again next month.